A mental health unit where 2 patients died in suspected suicides did not at any stage bring in more staff to help keep patients safe, despite repeatedly claiming that it did. The men died within 4 days of each other last month at Waitemata DHB's mental health unit, He Puna Waiora. One of the men, 24-year-old Tamaki Heke, who had fetal alcohol spectrum disorder, was only being observed the minimum once an hour by nurses. That's despite his foster parents, Rita and Peter Wilcox, repeatedly telling He Puna Waiora that Tamaki was distressed by the first death and at serious risk of killing himself. There are so many unanswered questions about exactly what happened at He Puna Waiora during 1 week in May. But here's what Checkpoint has discovered so far. Tamaki Heke and the other man who died 4 days earlier at this mental health unit were under what's called hourly therapeutic observations at the time of their suspected suicides. In plain speak, at least once an hour, a registered nurse locates and engages with the patient. It is the lowest level of observation, bottom of the rung stuff. Here's Tamaki's foster mother, Rita Wilcox.
When I found out it was hourly, it was just unbelievable because he went to bed at 8:30 at night, which is very, very early. That's suspicious. And a lot can happen in an hour.
Rita, a registered nurse, has been going through Tamaki's medical notes from the week leading up to his death.
I came across around 26, 28 events that I thought, why did they not pick up on that?
More on that later. But hourly observations is particularly significant in Tamaki Heke's case. Here's why.
He rang me, and he often would ring once or twice a day. He rang quite late for him. But he said, I want you to remember these songs. This is for my wedding, this is for my funeral, and this is for my anniversary if I ever have one.
That's Rita speaking to me last month about a phone call from Tamaki the night he died. His funeral talk was a red flag. So Rita called He Puna Waiora and warned them she thought her son was at risk of suicide.
I was given assurance that the staff are aware of this, they say, and that he is in good care. And then 3 hours later, he was dead.
So on the night, you rang and asked them specifically to keep a close eye on him?
Yes.
What would you regard as a close eye, Rita?
Have him in view that he would sleep, if he wasn't in high care, which I would have thought, then he would be sleeping in the lounge observation area. That at the minimum he would be there and they could have him in their sight all the time.
The DHB's own protocol details more intense observation options, including checks every 15 minutes. There's also what they call continuous engagement, so round-the-clock observation. And in acute cases, a patient must be within arm's reach of an assigned staff member at all times. Among the reasons given for escalating monitoring are active or imminent risk of self-harm, or having the intent and plan to commit suicide. Remember, Tamaki's mum, a registered nurse, believes in the week leading up to his death, there were more than 20 warning signs in her son's medical notes.
Him saying that he was feeling suicidal, or that he wasn't engaging with people, that he was... they said that he appears to be actively seeking ways to harm himself. He wasn't only seeking it out, but on the 16th at about 11 o'clock in the morning, he actually said to them, I just want to die.
He was that explicit?
Yeah.
And that's in his notes?
Yes.
Yet the night he died, he was still only on hourly observations?
Yes. He should have been on constant observation, and he wasn't. And I was shocked when I found out. I had no idea that he was not on constant monitoring.
The DHB says in the cases of both patients who died, the hourly observations were completed to the assigned level and each patient was seen by staff well within the time frame. When it comes to staff, during the morning and afternoon shift on a general ward at Hepuna Waiora, where Tamaki was when he died, there is a minimum of one registered nurse for every 5 patients. That's about 12 nurse minutes an hour per patient. It's also DHB protocol for nurses to aim to spend 1 hour face-to-face with each of their patients per shift. On night shift, it's one registered nurse for every 9 patients on the general mental health ward.
It just doesn't compute that they can do a good hour sitting there talking to them. I know they only have to do like 5-10 minute blocks, but even so, it's a lot of time in their 8.5 hour shift.
After the 2 suspected suicides at Hepuna Waiora, Waitemata DHB's Acting Director of Mental Health Services, Dr Kevin Cleary, told me the day after Tamaki's death that immediate steps had been taken to ensure patient safety, including boosting staff.
We have put in extra staffing because we know from our experience this is very traumatic for patients on the unit, for staff, and for the families of our patients. And we want to make sure that we can reduce the risk as much as possible.
It's important because Tamaki's foster parents say he was a known copycat and therefore at higher risk after the suspected suicide. As the interview went on, Dr Cleary doubled down on that claim. More staff had been brought in. How many more staff than usual have you boosted numbers to?
We have boosted numbers appropriately for the unit at this point in time. And obviously...
And what's that?
And that is, we have assessed the risk of the patients on the ward and we have added the number of staff that we feel is appropriate. Checkpoint
asked for details of those increased staffing levels. The DHB responded but did not provide this information, so we asked again. Here's the DHB statement.
No additional staff were required after the first death. After the second death, several replacement staff were brought in to perform the work of those going on sick leave. The unit was fully staffed at all times.
So, 0 extra staff. Contrary to the repeated claims of Dr Cleary, not a single extra staff member was brought into the mental health unit after the first death. And after the second death, replacements for those on sick leave, but no extras. Waitemata DHB says after both deaths, all patients in Hepuna Waiora had risk assessments and those considered most vulnerable were identified and plans made to manage their risk. During that week, Tamaki's mother says his notes do show he spent a short time in Hepuna Waiora's special high-risk mental health ward, meaning he would have been more closely monitored, but he was back on his usual ward when he died. In our earlier interview, Dr Cleary said this about telling patients and their families about the first suspected suicide.
We have spoken to all of the patients on the unit and we have spoken to their families and have explained to them what has happened and what we are doing and what we're doing to make sure that we have reduced the risk.
But Tamaki's parents only found out about the suspected suicide when their son posted a worrying Facebook message the day after the death, saying how sorry he was the patient had died and that he hadn't been there to help. Rita called Hepuna Waiora then too, warning them to watch her son, who was a known copycat. The DHB is now backing away from Dr Cleary's claim all the families were told.
Families are not routinely informed in the case of serious adverse events occurring on hospital wards.
After Checkpoint's initial interview with Tamaki's parents, the DHB contacted us, asking if we'd like to withdraw our Official Information Act request, given we had canvassed the issues already. We said no.
We haven't had any word from the unit or from Waitemata. We haven't had contact with them. We haven't been able to go and talk to them about what happened. Nobody's offered us appointments or, rung up to see how you're going.
For Rita Wilcox too, there are many more unanswered questions. The main one, how could this possibly happen?
And just because of one one thing that they didn't do, that putting him in high care, when he obviously needed to be there by all the comments, the warnings that I gave them, he just slipped through the net and, managed to take his own life.
And that's Rita Wilcox. If you need help in any way, you can call Lifeline. The number is 0800 543 354. 0800 543 354. You can also free call or text 1737. That number again, 1737, anytime, to speak to a trained counsellor for any reason. We asked Dr. Kevin Cleary on the show to clarify his statements. Late this afternoon, Waitemata DHB declined the invitation, saying Dr. Cleary was on leave and out of the country. In a statement, it said after the second death at He Puna Waiora, they closed the unit to new admissions for just over a week, meaning that staff-to-patient ratios were lower than they would have been normally, as there was still a full complement of staff and fewer admissions. We should also note that the DHB has launched 2 independent external reviews into the deaths.